So this is a breathing assessment, okay, just to find out whether your client is a chest breather or they're breathing with their diaphragm, as they should. Okay, so they should know what you're testing. You're looking for a box, okay? You put your hands on the belly, on the lower back, just feel where air goes. Here I feel lots of my front hand, nothing really in the lower back. A little bit higher up, chest, T-spine. Here I'm getting a box. So this is happening. Go to the lower ribs. Good, and I should feel my fingers expanding out. You don't want your fingers going up. Okay. Yeah, I'm getting some expansion there. Now, for me, one of the most important areas is here, the scalenes. You feel to see if there's tension, first of all. If I take a deep breath in, Sarah. There should be a big change underneath your fingers. If it stays fairly hard and there's no change, you've got a stress breather, or in a stress breathing state already. These muscles are used for lifting up the ribs so that your lungs can expand and get more oxygen in a stressful state. Exercise, running away from someone with a knife. Okay? If they are turned on and hard, just standing like this in a peaceful environment, they are displaying inappropriate firing. They shouldn't be firing standing like this. Okay? And this can lead to headaches, neck pain, restricted movement, because the muscles that you use to move are busy breathing. They can't do two things. So when someone has pain in the neck, lack of movement, right, have a look at their breathing. When the diaphragm drops, as it should, take a belly breath, the diaphragm shortens and drops, these muscles will relax. That's how muscles work reciprocally. You turn one muscle on, the other muscle must relax and release. So when you turn the diaphragm on, muscles up here must relax. Okay, so we're going to do one more assessment. Sarah, can you stand against the wall? Okay, feet against the wall. Hands against the wall. Head against the wall. Okay, so we're going to see what happens now. This is a neutral point of reference. You're going to see what happens when we put Sarah into a slightly uncomfortable position. Okay, put your hands up, like you're under rest. Okay, you'll find a lot of people can't get flat. Okay, this hand's a bit easier, this one's not. So already this is an assessment. You can start seeing maybe there's tension on the left. Sometimes their chin will poke up. Okay? And from a breathing point of view, if all these muscles are tight and stressful, okay, they can't release, they can't allow, not even external rotation, just neutral. So people, because of their breathing pattern, upper chest, start to go into internally rotated posture. They'll get kyphotic. Okay? If the ribs are flared, okay, the muscles that pull the ribs down towards the pelvis, okay, your obliques, if they're long, the ribs flare, the diaphragm is stretched all the time and can't shorten. Okay? And from that you can understand that even with poor breathing, you get a big lordosis, and it's not to try and tuck your tail in. Try and strengthen the core, try and get the diaphragm to drop, try and get them to correct their breathing, and all of a sudden, you get a nice neutral spine. Okay. Thank you. Thank you. Ooh.